Welcome to episode 6 of Walk in Our Shoes, a podcast about working at CHEO during the COVID-19 pandemic. These are brief conversations between CHEO's president and CEO, Alex Munter, and various staff and medical staff. This episode is a conversation between Alex and Dorothy Flemmings. Almost 20 years ago, Dorothy joined the Medical Device Rehabilitation Department, the MDRD, at CHEO. Out of the public eye, the MDRD is responsible for sterilizing and disinfecting medical equipment used throughout the hospital, like the devices used during surgeries, for instance. Listen to Dorothy explain what she does, why she's proud of her work, and how she thinks about the children and youth who come to CHEO for surgery.
So next year, I'm going to give you your 20-year pin here at CHEO.
Yes.
You're almost here 20 years. Congratulations.
Thank you.
Without an MDRD, we would shut the whole place down. The impact of what you do is felt in every part of the hospital. So for those who don't know what the Medical Device Rehabilitation Department is, just explain a little bit what you what your team does.
As you say, we're very essential to the hospital, especially for surgery and for the surgical units. We sterilize surgical equipments, basically to prevent any kind of infections.
You're ground zero for patient safety.
Yes.
Sterile supply technician, what does that mean? What do you do? What are you going to spend your shift today doing?
The start of my shift, see what cases are going on, what instrumentation are going to be needed. So we need to sort them, disassemble, pre-clean, wash, sterilized, cooled, and return to the OR. That I don't really know what I'm going to face when I come in, and it is a challenge for me. And I really do like that.
Even after 20 years, it's different every day.
It is different.
And what's the most stressful part? What's the hardest part of the job?
Say, for example, like today's a prime example that they have a spinal fusion case that they're performing. In the middle of doing that, you may have CB clinic calling, for example, that they need some scopes processed. They need them back. So you have to stop, put the scopes up, bring them back, process them, and have them return in the middle of doing your sets for the spinal fusion. While you're doing that, the OR may call and say, we have an emergency laparoscopic appendectomy. We need that stat. You have to stop again, pick that case, return, bring it to the OR. It comes down. They're like, oh, we have 2 more. We only have so many sets, so you have to get that processed and back up to them in a timely manner for them to be able to perform the other surgeries. So you never know what might happen or what calls may come in, but you have to attend to each one.
You're also clearly, you've been here almost 20 years, 20-year
Yes.
pin coming. You're also proud of CHEO.
I am.
What makes you proud to be part of CHEO?
Community. That's the first thing that comes to mind when I think of CHEO. Community. I know that from far and wide within the Ottawa area, all the children that needs help medically, this is where they will come. So I could be walking and there could be a child and thinking that, you know what, that child could be just coming from CHEO or going to CHEO. So I think of CHEO as community. I don't know, that's the best way I can describe it. It's everything in one. It's community, it's homely, it's friendly, it's accommodating. It's just a great place to be. I don't know how else to put it.
Well said, well said. So can you talk about how your work has changed since the pandemic started?
Since the pandemic started, in the beginning of the pandemic, we slowed down a bit. There were not as many elective surgeries. So we turned course and we started to do something a little bit different. We were processing face shields. So in addition to the OR may have cases, emergency cases, we were doing that in the meantime. So we kept going. Yeah, so that was part of what we were doing. We were doing our little part by assembling shields, and we were doing hundreds a day. It was a tedious job, but it was something different. And we, just to be able to contribute our little part to it was great.
And actually, we've hired a couple more technicians, right? Because we're doing we've increased the number of surgeries we're doing because we're doing. So the other way you're helping right now is we're trying to catch up on the backlog of surgeries. And so that means we need more technicians, more equipment going through to run more ORs longer, right? Can you talk
definitely.
About that?
So we are, at this moment, we're looking to have more technicians. We've had 1 or 2 new hires, and we're looking for more. But yes, with the OR ramping up the surges of the backlog, we definitely have started.
You sound really proud of the work you do.
I am. I really am.
It's really nice to hear.
I have kids, So I'm always thinking that could be my child upstairs. So I always try to do my work in the best interest of not just the other patients, but that it could be my child. So I'm always thinking of them and that I'd want the best for them. So I work with that in mind.
This has been Walk in Our Shoes, a podcast about working at CHEO during the COVID-19 pandemic. If you think a career at CHEO, in the Medical Device Rehabilitation Department or elsewhere, might be right for you, see the careers page at cheo.on.ca. CHEO is a global leader in pediatric healthcare and research. Based in Ottawa, CHEO includes a children's hospital, children's treatment centre, school, and research institute with satellite services throughout Eastern Ontario.